Hi there. I want to share a case study with you to kind of give you an idea of what separates being a functional medicine practitioner in the medical space from a general practitioner. And this may give you guys some hope if you've been suffering a lot from, debilitating symptoms that you're just not getting answers with. And it's a really great case study. It's so much so that I just felt the need to share and use it as an example of what is possible. So often I get patients who come to me with symptoms they've been having for 20, 30, 40, 50 years, and they're still struggling and would like to have them resolved. Things like chronic headaches, chronic pain, chronic roaming symptoms. And, when we sit down and we go through, all their symptoms, their life history, typically we can find some key areas that could use some benefit of some changes, right? So usually diet is something that we have to discuss. There's micronutrient deficiencies that maybe have happened over time. There's some genetic impacts, but you can always, support various levels of genetics. But lately, I've had some pretty complex cases coming to me, and we have to do a little bit more digging. Now, here's a case in point. This is somebody who she's 43. She had her uterus removed because of heavy bleeding back in her early 30s, and was told that nothing would be a problem for her. And since she was a youth, she's had chronic, severe, almost daily headaches, mostly topical. And now, since her uterus has been removed, and then she's in the last few years, she's really struggling with a lot of body pain, mood dysfunction, chronic fatigue. So I decided to send her to a colleague of mine who helps me with getting blood work done at a low cost. And we did some pretty in-depth blood work. And then I compared it to some of the older blood work she had done since 2017. Now, this is where it gets really cool. So you think, well, maybe it's just, nutrition deficiency, maybe it's dehydration. So we've worked on that. We've done some acupuncture, and, she's done a heck of a lot better, but not enough to really crack the code. So when I got her blood work back today, it was so exciting because not only did we find that she's in premature menopause, at 43, it's too young. And so now she's going to be going for some hormone replacement therapy, going to start slow and work up. That's going to be a game changer for her. But also, we noticed that she has some genetic issues with absorption of B12 into her cells, which helps make your red blood cells. And then, most importantly, I saw the pattern, which is what functional medicine practitioners usually do. So we're looking for patterns in your blood work and test work and your symptoms, And I saw the pattern of something I've never diagnosed before, but it looks like what's called thalassemia. And this is there's various levels of it, and it's thalassemia minor. Now, I do want to get it genetically tested to make sure that that's exactly what it is. Perhaps there is mostly a nutritional deficiency that is contributing to this. But, we went back in blood work all the way back to 2017 and compared it to today's, which was done last week, blood work. And it's consistently showing that red blood cells are above the normal range by a little bit. And her MCV, which is a measure of how big those red blood cells are, is a frank deficiency. It's absolutely below the low normal of any range. And when you see that kind of pattern, and but with normal iron levels, normal hemoglobin levels, you know that it's probably thalassemia. It's not an iron issue. She has enough iron, and her body can stabilize her iron in her bloodstream, but she doesn't have enough quality made hemoglobin to carry enough oxygen to all her tissues. So she's going to be chronically fatigued and have a lot of dysfunction. So I think we cracked that one, but it's a difficult one to treat. The exciting part was that she got a lot of relief out of finally hearing somebody say there's a reason, and it's not her fault, that there's all these symptoms, and that there is at least some hope that we can try and manage it. And what the disturbing part was, why do you have to get to age 43 before somebody notices this pattern that has been obvious in blood work for at least since 2017, no doubt longer than that? Why do we have to wait that long? So my plea to you is that if you're listening to this and you are suffering a lot with symptoms, stop just doing what you've always done and trusting the medical practitioners you feel you've always trusted because that's who you're told to go to. And maybe you go because it's quote unquote free in Canada. It isn't actually free, but it seems like it is. It's not coming directly out of your pocket at time of service. Start looking for people like myself, if not myself, and get some different eyes who see a little differently the same kind of markers and look for patterns and get in front of this suffering and so that you don't have to suffer so much any longer. I have a feeling this lady is going to do much better now, and I'm so proud of her for having finally reached out to somebody who looks at things a little differently. And I'm really, really glad that I have the skill set that I can look at these kinds of markers and information and see it differently than many of my colleagues. It doesn't mean I'm right about everything, but when I am, it's pretty fantastic, and it changes somebody's life in such a dramatic and pretty simple way. All we have to do is dial a few things in, get a little bit more testing, I think, to verify a diagnosis. I think I'm right, and in the end, I have a feeling she's going to have a much better next half of her life. So just use that as a case study, as an example of maybe there could be something like that for you. It won't be thalassemia. That's pretty uncommon to find, certainly in the populations in Canada, but it does happen. And you just need a geek like me to kind of tease through some information and find another way of approaching your care. That means, though, that there is more responsibility on your shoulders for doing the work to make the shifts, to get the changes that you want to see in your body. It's not usually a pill deficiency. It's usually a lifestyle insufficiency or deficiency or oversufficiency. Once you dial in those things, though, life is grand. So I hope that is inspiring and helpful. And find a geek like me. It could be me. It could be somebody else. But make sure that their training is such that they look at things a little differently. And sometimes that's all that's needed is to just have fresh eyes look at your specific YO unique case and help you, make some changes over time. I call myself a guide on the side. I'm not a sage on the stage. I'm a guide on the side, and that's what guides do. They look at the terrain and they say this is the direction you would most likely get the best, walk out of if you're going on a trail. So look for a geeky guide on the side, and maybe they can help you navigate, test work and, your host of symptoms like I did with this lady today. So I hope that's helpful. Take care.